Excellent. So thank you very much, Dr. Cajina, for agreeing to talk to us about your experience. Why don't you introduce yourself, tell people who you are and what you do for a living.
Yes, my name is Luis Cajina. I am an anesthesiologist. I work at Lake City Medical Center in Lake City, Florida. And I've been in this community since 1998, long time doing anesthesia. And I just retired a couple of months ago.
Congratulations.
Thank
So,
you.
as an anesthesiologist, what were your thoughts about having back surgery under conscious sedation?
Well, it was kind of new to me. I knew about spine surgeries under general anesthesia, but under conscious sedation, it was kind of very new. But my son, who is also an anesthesiologist and works with you, recommended me to come to you because he knew that you were doing a fantastic job over there with other patients, and also my expectations would be filled, with this type of surgery.
So, as an anesthesiologist, did you have any particular concerns about having general anesthesia, or perhaps maybe some of the cognitive effects of general anesthesia?
Not really. Not really for general anesthesia. I know that as we grow older, we are losing our cognitive capacities, and we are having some limitations. And general anesthesia could be more deleterious, than regional anesthesia or more limited type of anesthetic, for certain surgeries. So, but that was my feeling,
Mm-hmm. So, as a patient, now being on the other side of the equation, and as a patient, did you have any particular thoughts or concerns about having surgery under conscious sedation or regional anesthesia?
Well, at my age, I have had some endoscopies, and I know, and being an anesthesiologist that is practicing that specialty, I know that we can render the patients unconscious, but at the point where we don't have to manipulate the airway, and at the same time, the patients wake up sometimes, not knowing anything about what was going during the procedures. So I think the spine surgery is very intensive, and I didn't know that you could do it, under regional anesthesia or more limited, trying to avoid, the general anesthetic.
So, I know that you've performed spinals before and you've performed blocks, but being on the other side, what was your experience like when you first had the paraspinal block?
It was something new. As a matter of fact, my son told me about the block, and I was okay. I was ready. I was in the hands of good people. I knew I trust you, and I knew that I was going to be all right. So I just rendered myself. I was the patient, and at that point, I was surprised. The block was very simple to me as a patient. I don't remember to have suffered anything. I mean, they gave me a little bit of Versed, and from that moment, I was sitting up, and the block was excellent. As a matter of fact, after surgery, I mean, it was a little longer than 48 hours when I started feeling pain. I mean, some discomfort. That's what I mean.
And did you have to take any pain medication after the surgery?
I did. When I started feeling the discomfort after surgery, I took for 24 hours, I took the narcotics that I was prescribed. And that was it. Because the narcotics were so, the side effect of constipation was what really bothered me as much as I said, I cannot continue with this. And I started using my non-steroidal anti-inflammatory drugs.
So do you remember anything about your surgery?
In the middle of surgery, I remember that I felt something, and I said, "I'm feeling something." I think I talked. I don't. That's the way the only thing that I remember. I was prone, and I said that, and immediately they gave me something else, and then I don't remember anything else until I woke up in recovery.
Yeah, we did have a little bit of a conversation during your surgery. I asked if you were experiencing any pain, and you said no, you just felt that that there was something going on, but it wasn't painful.
Okay.
As a patient, going into the surgery and lying prone and having surgery on your back and making the incision, I think patients are afraid they're going to feel pain or feel something. Did you feel any of that?
No,
Yeah.
Not at all. As a matter of fact, I remember when they told me we're ready to go to the OR, I remember that I transferred myself from the stretcher to the table, and that was it. I don't recall anything else after that, except for that brief time when I mentioned, that I was feeling something, and then I fell asleep again.
That actually brings up a very, very good point, in that with the awake spine surgery, allow the patient to position themselves so they get very comfortable, and the likelihood of getting pressure sores and areas of bruising actually is quite small, because you're able to position yourself and get completely comfortable.
I do agree.
One of the other things that patients are worried about, or have had surgery in the past, experience some significant side effects such as nausea and vomiting and constipation after surgery. And I'm sure that you counsel your patients about that as well. How do you compare, the regional anesthesia with the sedation to general anesthesia vis-a-vis those types of complications, or side effects, I should say?
Definitely a regional anesthesia, and is going to have less of those side effects. We cannot compare, one to other. We see more nausea, vomiting, with general anesthesia than with regional anesthesia. So I don't remember. I didn't have any of those. No nausea, no vomiting. The pain was tolerable, as I said, for more than 48 hours. And also the only side effect, the constipation, was more related to the pills, the narcotic pills that I started taking when I was starting to feel pain, than anything else. I mean, I discontinued that and everything. So
yeah, I think it's important for the audience to know you had a 2-level minimally invasive laminectomy, and it's as part of your regional anesthesia, you had a paraspinal muscle block with bupivacaine and Expro, lysosomal bupivacaine, as well as intrathecal fentanyl. And that lasted almost 48 hours, which got you over the hump, which is what the hope is. And so I guess that the biggest question, now having been through this, if you had to have back surgery again, would you have it with regional anesthesia, or would you want general anesthesia?
No, regional anesthesia is perfect. Regional anesthesia is perfect. I have no complaints, no whatsoever.
Well, that's wonderful to hear. So there's going to be some people who are not surgeons and not anesthesiologists who are going to see this video. If you had anything to say to a potential patient who is considering whether or not to have regional versus general anesthesia, what would you tell them?
I would recommend to have regional anesthesia. It's feasible, it's possible, it's great, less chances of having side effects, and I think you can do the surgery maybe ambulatory that way. So because I went home the same day. It's another thing, that is a must, So I would recommend regional anesthesia for your patients, having minimally invasive.
Well, I think this is going to be very valuable for both patients and for surgeons who are considering doing surgery with regional anesthesia. And I can't thank you enough for sharing your experiences with us. I think this is very valuable. So thank you.
Thank you. I'm feeling great.
Fantastic. I'm so glad you are. All right, stop this recording now.